Hi everybody, welcome to session 5, Cognitive Behavioral Therapy for Managing Chronic Pain. This session will be focusing on the cognitive triad. Please don't forget to press like and subscribe. Hi everyone, this session will be focusing on the cognitive triad. What is the cognitive triad? Essentially, the cognitive triad is manifested on 3 main elements. 1 is your negative view of yourself, 2 is your negative view of the world, and 3 is your negative view about the future as a whole. Now, people who have chronic pain essentially experience self-esteem, low self-esteem, and low self-confidence depending on the magnitude of their pain, depending on the severity, and depending on the fact how much their lives have been altered with respect to their pain. So it's common for them to feel that they are, for example, worthless, useless, solely defined by their pain, that they're unable to see themselves in any other way other than someone who has pain. So this is their negative view about how they feel about themselves, which is also comprised of their self-esteem and self-confidence. Now, self-esteem, again, is how you feel about yourself, how you see yourself, whether it's physical or how you actually feel you are represented to the outside world and how they perceive you. Self-confidence refers to your functionality and your competency, your belief in how well you're able to accomplish things, how you're able to be productive or not productive in society. So when you have chronic health for a long period of time, or rather as the name implies, chronic, forever, it's very difficult to have high self-esteem and high self-confidence. Now, with respect to your negative views about the world, essentially, when you already possess a negative view of yourself, you ultimately, correspondingly, would have a negative view about the futures as well, about the world. So the world sees me as useless, the world sees me as inadequate, the world sees me as unable to function and to fulfill my responsibility and to be a productive member of society. Again, these are feelings and thoughts that are independent of anything else and just basically restricted to that person's frame of mind. Third is your negative view about the future. Essentially, referring to I'll never be able to move past this. I will never see things differently. Nothing will happen for me that's positive. All the obstacles that are in my life will continue to be there, and I will have no power and no ability to move against them or to make progress. So that's your initial feeling about how the future is going to pan out for you. So a negative view of yourself with respect to the cognitive triad is fundamentally manifested on the socialization process. Now, the first individuals who are responsible for socialization, of course, are parents and or any caregiver that you've had. So kids who have more secure attachment patterns, more positive experiences with parents, tend to have higher self-esteem and higher self-confidence. Now I'm saying tend to or may, because nothing is a guarantee. Now kids, by contrast, who have more of an insecure or an avoidant attachment pattern to their caregivers, depending on what their experiences were, can have lower self-esteem and lower self-confidence. Now, what they do with that in future or as adults remains to be seen. Some people either work through it or some people don't, depending on where they are in their life. Now, people who have chronic pain, this is now compounded by adversity and challenges that they didn't see coming, that just happened to them by virtue of a particular accident or a trauma. Like I mentioned before, their frame of reference, how they see the world and how they see themselves, is shaped by the experiences that they have had early in their lives. Again, early within the socialization process. Kids who are more resilient, kids who are better able to cope, tend to be more confident, tend to bounce back. They are less sensitive. They are less consumed by grievances or by situations where they feel that they have been treated unfairly. Essentially, they get up and they keep going. Where people who have less resiliency tend to fixate on those experiences and they are consumed by them. So when adversity hits, they're less able to move past it. Now, interpreting experiences negatively and in an unbiased manner refers to how people see themselves in terms of the world, how the world perceives them. Again, in the last session, we talked about cognitive distortions and how people utilize emotion, irrational thinking, lack of reason and rationality in order to interpret the experiences happen to them. People who have chronic pain, people who are taking medication for the chronic pain have greater challenges. They have more frustration. By virtue of that, they have less ability to see themselves in a positive way. Therefore, how they feel about themselves is how they interpret that the world also feels about them and how the world perceives them and their competency. So if they have low self-esteem, they feel the world will see them as that way. If they have low self-confidence, they feel the world will does as well, accordingly. Negative views about the future. So essentially, people who have negative views about themselves, negative views about the world, are not going to miraculously have positive views about the future. People who have this sort of thinking of, I'm going to be in pain, I am in pain, I am my pain, I can't move forward, are essentially more willing to believe that the future will also be bleak correspondingly, that they are not going to have any progress, they're not going to have any positive experiences, they are not going to be engaging in any activities that other people do. Essentially, fundamentally, their belief is manifested upon the idea or the notion that things will never change. Things will always remain the same, and they will never change, and they will remain the same in the distressful situation that they're in. Now, how do we reverse the negative triad into a positive triad? So, negative view of oneself, low self-esteem, low self-confidence. How do you change that? Well, it depends on how deeply entrenched your feelings of negativity about yourself are. There's a difference between already possessing negative self-esteem and negative self-confidence and having it being compounded or exacerbated by chronic pain. There's no dispute that the existence or the prevalence of chronic pain will have a negative impact. So sometimes even the most confident, even the most competent, even the most high self-esteem individual can feel that they can't get beyond what's happening to them. So for example, a lot of people with chronic pain, one of the things that I hear a lot about in my practice is the fact that I cannot get out of bed. I'm going to sit in my bed, I'm going to lie down in my bed in my pajamas, and I'm just going to spend the day like this, because what's the point? Well, instead of remaining in bed in your pajamas, if you were to get up, to take a shower, to comb your hair, and these sound like superficial things, but in totality, how you feel about yourself, how you look at yourself can change the way you feel and how you present yourself to the world. If you see yourself positively, essentially the world will too. It depends how you interact with people around you. It depends what kind of energy you're giving off. Now, I'm not saying get up out of your bed and you're gonna look like a supermodel, but for you, what matters is what is good for you or what makes you feel good. Not doing anything will ensure just staying the same. So self-esteem comprised of your appearance, how you look, and how you feel about yourself also impacts your level of competency, your level of activity, increasing your self-confidence and your energy, decreasing your anxiety and decreasing your depression. Interpreting experiences positively and in an unbiased manner with respect to how you see the world, your negative view of the world. The world doesn't owe you anything. The world isn't going to cut you any slack, obviously. This is where you are now. So as unfair as it is, as frustrating as it is, the world is not going to change in accordance to make it better for you. So how are you going to exist within the confines of this unfair world, so to speak? So you're in pain, you're frustrated. How are you going to experience what's going on? How are you going to see things differently? So with respect to cognitive thought distortions that was discussed in the previous two sessions, seeing the world in a polarized way of thinking, catastrophizing, minimizing, overgeneralizing, being able to only view the negative aspects of an experience. For example, if you go outside for a run, you come back and you're in pain, suddenly it's a disaster, you can never go running again. That's your view of the world, that the world is not going to help you. So since the world's not going to help you, you can't help yourself, you're going to just stay in the cycle of negativity over and over again, redundancy. Repeat, redundancy, lack of activity. Now, retaining a positive view of the future, notwithstanding the reality of the pain that you're in. So I'm just going to reiterate that for a second and spend a few minutes on that. So again, there's no dispute that you're in pain. There's no dispute that you're struggling. There is no dispute that you're on various medications and you're frustrated about the efficacy or lack thereof. There's no dispute that the world as how you saw it has now been altered. There's no dispute that your functionality, what you used to do, how you used to be, is now different. These are all facts and realities that you contend with on a daily basis. Notwithstanding all of that, how can you accept the reality that you're in, but changing it towards something more beneficial? That's where coping comes into play. One of the first things that I said when we started this workshop was that chronic pain may not be eradicated. The only thing that we can do is to cope. So enhancing your coping abilities is important in order for you to live within the reality that you're currently engaged in. So you can't change the reality, but you can find different ways of dealing with it. So if you're going to sit at home on your couch in your pajamas, you're not going to make any effort to get up, or you're not going to make any effort to exercise or to do things differently on that day, absolutely nothing will change. You will feel negative about yourself. You will feel that the world views you negatively, and you'll have a bleak perception of the future. Now, let's compare a positive person and a negative person. Now, before I say that, again, for the sake of redundancy, I just don't mean to be facetious. However, thinking positively is not sufficient by itself. So it would be great if you sit here and say, okay, I'm going to get up tomorrow and I'm going to do this, 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 and this. But if you don't actually do it, then these are just dreams in your head. They're not actual goals. Goals are predicated on a plan of action that's concrete, that's realistic, that's relevant, and that's attainable. Again, if while you're lying in bed the previous night you tell yourself, tomorrow I'm going to run for an hour, that may be an extremely unrealistic expectation you have set yourself up for. And it will result in failure and disappointment and the tendency of you to stay home on your couch and not do anything because it was unrealistic. So yes, think positively. Yes, be able to see things in a positive way. However, by the same token, good luck or pain relievers are not going to drop out of the ceiling. You're not going to be able to miraculously extract yourself from what's going on unless you actually make a change. The first step is to acknowledge that there's a problem, to accept the reality for what it is, and a desire to change, and then to make a plan to actually change. Now, I just want to make an example or a comparison between type A and type B. So person A, person B. Person A and person B both have suffered the same injury. Let's say it's knee pain. That's my favorite one, I guess, to talk about. So person A, person B, same age, same gender, same basically everything, same injury for the same amount of time. Person A is a negative person. So their perception is, I have knee pain. I went for a run yesterday for 10 minutes and I came back. I'm in worse pain than I was ever before. Now I'm going to be on ice. I'll be resting my knee. There's nothing I can do. I should have never gone, etc., etc., etc. So that's person A. Person B gets up and goes for a run. Again, same injuries to be noted. They go for a run, they come back, they're in pain as well, but they rest their knee and they say to themselves possibly, okay, I went out for a run, I ran for 15 minutes, I did 5 minutes more than yesterday, I'm in a little bit of pain, maybe tomorrow I'll take the day off, maybe I'll rest my knee more, maybe next time I'll do less. Whatever it is that they decide to do, how they see the situation varies. Which brings me to the most fundamental and key point in this entire workshop, which I will again reiterate in the future. The perception of person A and person B. What is the distinguishing factor between person A and person B? It is their perception of their pain. Their perception is very different. Therefore, they have different feelings, different thoughts, and different actions. Person B, who was the positive person, also has pain. They're also in distress, but their perception of it and how they experience it is very different. They acknowledge they have the pain, they acknowledge their frustration, but the main fundamental difference is that person B, who is the positive person, has committed themselves to a state of acceptance and resistance. Whereas person A, who's a negative person, has unfortunately committed themselves to a state of resignation and defeat. That's the main difference. Person B says, I'm going to keep going. Notwithstanding how horrible I feel, I'm going to keep going. Whereas person A says, I have to stop because I'm never going to get through this. So again, how we change our feelings, how we change our thoughts, influence our behavior at the end of the day, corresponding to how we feel. So how we feel, how we think, how we behave, they're all interconnected. They're all related to each other. So person A is not saying that my pain is more than yours, or on a scale of 1 to 10, my pain is at a 12 and yours is, it must be at a 15. They've had the same experience. However, again, one other difference between person A and person B is that person B is not using cognitive thought distortions in order to determine their level of pain or their experience. So person A is consumed by emotion, irrationality, lack of logic, high intensity of distress, where person B is able to use logic in order to see the situation a different way. Now, person B might just be more resilient. They must have better coping mechanisms. Maybe, maybe not. Maybe they are innately more able to be strong or to see things positively. Whatever it may be, at the end of the day, nothing's going to happen just by positive thinking alone. There has to be some actions to back up what you intend to do. Thank you very much for watching. Please don't forget to subscribe and press like.